bring her in here.
Oh, are you okay?
I'm really warm.
Alright, can you tell me what's going on?
Well, I just don't know what's going on really. I'm just really hot and I'm sweaty and
Okay.
something's wrong.
Alright, well, my name's Marisa at Carrington Hospital. I'm going to take care of you today, okay?
Okay.
So we have you sitting up, and we can get you some cold packs if you want. And is there anything I can get you right now before I talk to the doc?
No, I just need help.
Okay. Can you tell me about when your problem started happening?
It started, we went to the lake today and we were laying down and having some drinks and I just started to feel very weird and she helps me, this is my friend here. She helps me, she took my blood pressure because I had a spinal injury a couple years back. It was like a T6 spinal injury. So
Okay.
the doctor, I can't remember what it's called, maybe you could help me out, but the doctor said that my blood pressure could skyrocket from this injury.
Okay. Has it gotten high in the past, your blood pressure?
It's never happened before.
It's never happened. Okay, so this was just one incidence where it came up.
So I haven't gone to the bathroom in a long time,
Okay.
so maybe that's why, but I don't feel anything, I don't feel like I have to pee, so.
Okay. And then have you been taking any medications?
No,
No? Okay. And do you have any allergies?
no.
No?
She
Okay.
said her head's been hurting all day.
Yeah.
When she was laying down, she said it was way worse. And then we got in the car and it felt better, but I still brought her here because she looks so hot and red and sweaty.
Okay. How is your pain now?
Well, my pain is pretty bad up top.
Okay, so can you describe it for me? Is it throbbing, aching, burning?
It's from being so hot.
Okay. And on a scale of 1 to 10, can you rate it for me? 10 being the worst?
6.
A 6?
Yeah.
Okay. So I'm just going to do a small little assessment before I find out what the doc wants to do for testing wise. He's on his way. So I'll go ahead and put this automatic blood pressure cuff on you.
Do you guys have any catheters here? Because she hasn't gone to the bathroom in a long time.
Yeah.
We didn't bring any with us.
Yeah, if you haven't gone, we definitely have catheters here.
I usually do it at home. That's what they taught me. They said that makes it really bad sometimes. So maybe that's what it is. I don't know.
Okay, and I'm just gonna go ahead and guess that the doctor will want to get a urine sample from you anyway. So we'll go ahead and get the catheter for when we run those tests.
Okay.
And while the blood pressure is reading, I'm gonna go ahead and check your pulses. You are very warm and sweaty. Your heart's beating really fast and your pulses are beating pretty hard.
Uh-oh. What does that mean?
You're a little red. It's just that by the looks of it, your blood pressure is running really high. It's about 168 over 86. Did you take your blood pressure earlier?
Yeah, she did. I don't remember what she said though. I'm having a hard time concentrating.
Okay. Was it lower or higher?
It was a little bit lower, 160.
Okay. So it's just increasing over time.
Yeah.
Alright. And so since you had that spinal cord injury, there could be other things triggering your hypertension. So that's why we're gonna go ahead and run some tests, okay? So I'll go talk to the doctor right now about what tests he wants to run, and I'll be right back.
Okay. Thank you.
Dr. Shepard.
Hi, doctor. We have a patient that came in. She has a history of a T6 spinal cord injury. So what was going on was she was at the beach and was out in the sun tanning, and then she started to feel very warm, not feeling well. She has a severe headache. She also told me that she hasn't straight cathed herself all day, so I'm definitely thinking autonomic dysreflexia. Let's see, what else does she have? Her friend stated that she had a little bit of blurry vision. Her blood pressure was 168 over 86, so that was pretty high. Her pulses were bounding. She's sweating. She had goosebumps on her legs, very flushed. Let's see what else. And she had also been drinking alcohol today. She didn't tell me any allergies. She said that she doesn't have any. and she is not on any medications currently. So what I'm thinking, since it is most likely autonomic dysreflexia, I'm thinking a blood sample, a urine sample, a CT or MRI. We could also do a toxicology report and a tilt table testing. What do you think? Okay, perfect. All right, Crystal, so the doctor told me which tests he wants to run, but let's go ahead and straight tap you, okay?
Okay.
And can you tell me when your last bowel movement was?
It was actually this morning.
Okay. So we'll just go ahead and work on getting rid of any factors that can trigger the hypertension, okay?
Alright.
You grab some gloves. Alright, I have the catheter all set. I want you to go ahead and take a deep breath, okay, and just relax. Are you ready?
Yes.
This seems so scary.
Right. This does seem scary, but this will hopefully provide you some relief.
I do it at home all the time. It's not scary.
Alright, here I go. 1, 2, 3. Alright, urine's coming out. Looks very good.
Wow, that's a lot coming out.
Yeah, definitely can tell that you haven't straight cathed all day. That bladder was holding in all that alcohol. Crystal, can you tell me your name and date of birth?
Crystal Bartell, 42591.
Alright, I'm going to scan your armband. We're giving you an antihypertensive medication called nifedipine.
Yeah, what does that mean? What is hypertensive?
It's when your blood pressure is really high, like it is now. So that's just what hypertension means, okay? So this medication will hopefully lower it, alright?
Oh, okay.
Alright. Did that go down okay?
Yes, it did.
Alright, perfect. I said earlier I'm going to talk to you about the test that the doctor wanted to go ahead and run.
Okay.
So we're going to go ahead and send off that urine sample to the lab. We're also going to get a blood sample.
Oh, God.
And we're going to do either CT or MRI. And then he might do other testing, such as a tilt table testing or toxicology report, okay?
Well, I don't do drugs.
I know, but it's just checking to see if you have any chemicals that might be causing the hypertension, okay?
Oh, okay.
It's nothing to worry about. This will hopefully let us know what is causing the problem, okay?
Okay.
We're kind of hungry though. Do you think I could go get her some food before the
But I think he's going to want you NPO, so
What does that mean?
no eating or drinking before the tests,
Oh.
okay? But we'll go ahead and check your blood pressure since we've done a few things to help lower it. Hopefully the medication and straight capping you has worked, okay?
Okay.
There's a lot of stuff in this hospital room.
There is.
It's a crowded hospital.
Very busy today.
Sorry.
You're fine. Alright, so while we wait for that, I'm sure you've heard of it before, of things that can cause the blood pressure to skyrocket, like you said, such as tight clothing, or that's why I asked you about your bowel movement, if it has been a while or not, and then the bladder. And it looks like the blood pressure went down a little bit. It's 158/80. So that is good that it went down a little bit with medication and straight cathing you. Let me just go make sure that the orders have been put in for the lab tests, and then we'll go ahead and send you off, and then we'll bring you back and I'll talk to you a little bit more about it, okay?
Okay.
I'll be right back. Hi, Crystal. So I triple checked and the doc put in those orders for the tests.
Oh, okay.
I just have to ask before we run them, is there any way you could be pregnant?
No.
All right. And then, so since we are doing an MRI, I need you to take off all of your jewelry, okay?
Okay.
Here, I'll give it to your friend to hold on to.
Why do I have to take this off? I don't understand that. What this has to do with my blood pressure.
Well, this test, Metal can interfere with the test results, and also the MRI is like a big magnet. So we don't want any of your jewelry to be pulling out or anything like that. All right, we're back.
Oh, hey.
That was so scary.
Aww.
All right, and you got all your jewelry back and everything?
No, I didn't actually. Do you have it? Thank you.
I think she's still kind of confused.
A little bit, yeah.
I think I'm just so hungry. Can I eat yet?
You can eat now.
Okay.
Go, I got some fries.
Thank you.
All right, so I'm just gonna talk to you a little about this condition and what happened today, so that way you know what to expect if it happens again. We did all those tests and you didn't show any infection or other problems.
Good.
So I'm definitely thinking that the full bladder was the problem.
Oh, I guess we messed up.
Yeah.
So just definitely remember next time to set up a schedule for when you straight cath yourself, okay?
Oh, okay.
But usually what happens with anybody who has an injury between T5 and T9, they're at risk for the autonomic dysreflexia, which is just systemic hypertension. Your blood pressure is really high. You get very warm, flushed. You can have a headache. But anything below the level of injury, also like the full bladder or say an obstruction of any kind, say if you haven't had a bowel movement in a while, that can trigger the blood pressure to go up, okay?
Oh, okay.
So what happens, it's very weird, as the blood pressure's happening, your body's not able to adapt to it all the way, because above the level of injury, you have vasodilation to try and decrease the blood pressure, but then below the level of injury, you have vasoconstriction. So your body just doesn't know how to adjust to it.
Oh.
So like I said, you could have flushing, sweating, and even nasal congestion above the level of injury, obviously. And then below, you could be pale, it could be colder, and you could even have goosebumps on your legs like you did have. So it's just two different effects on the upper half and the bottom half of your body.
Okay.
You could also, like I said, have the severe headache. You can have an anxiety feeling, nosebleeds, and feel short of breath.
Wow.
So basically, we just want to keep the hypertension under control whenever that happens. You did the right thing coming in today, because hypertension can have some pretty bad effects on the body. So I just want you to continue to monitor your blood pressure. Remove any triggers, which could be the tight clothing, the full bladder. Make sure you had a bowel movement. Set up schedules for that. Any skin issues such as infection, lesions, burns, even ingrown toenails can trigger it.
Wow, no one ever taught me this
Yeah.
before. They just told me about the bladder.
Oh wow, okay.
Yeah.
So UTI, and always check that catheter if you have one that stays in. Always check it, make sure it's emptied properly and kept clean. Any bone fractures can also cause it, and just anything that's irritating below the level of injury where you had can trigger it. So, and also make sure to do periods in and out of the sun. Don't get too hot. The alcohol can also cause it, so don't drink as much maybe next time.
It's her birthday.
I understand, but drink some water, make sure you're cathing. So it doesn't look like the doctor's going to have you do anything else while you're here, so we can go ahead and send you home since blood pressure's under control now. If this happens again where you have a severe headache, try and sit up all the way first, see how it is. Check the bladder, check the bowel, anything, get rid of those triggers.
Okay.
And if your blood pressure still doesn't come down, come to the ER, okay?
Okay. Thank you.
You're welcome.
Thanks, nurse.
Feel great.
No problem. Have a great day.
You too.
Bye.